All right, welcome back. You're watching Live Now. I'm Austin Westfall. A live look at the White House on this Monday evening, 10:09 in the nation's capital. President Trump announcing that taking the common pain relief drug Tylenol during pregnancy can lead to an increased risk of autism for unborn babies due to the drug's active ingredient. We have been following this all day. Of course, this has been causing some scientists and researchers to say that they're highly skeptical of some of the verbiage that was used from the White House today. Fox's Rich Edson with the story.
The Trump administration is warning women to avoid a popular medication during pregnancy.
With Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly.
Federal health officials are advising pregnant women against taking acetaminophen, the active ingredient in Tylenol, unless they have a fever. This follows research from Harvard and Mount Sinai that suggests a possible link between use of the drug in early pregnancy and autism.
They are paying attention to studies and the gold standard of science and research that many in this city for far too long have turned a blind eye to.
The company that makes Tylenol maintains more than a decade of rigorous research endorsed by leading medical professionals, says there is no credible evidence linking acetaminophen to autism, and that without Tylenol, quote, women face dangerous choices, suffer through conditions like fever that are potentially harmful to both mom and baby, or use riskier alternatives. President Trump's first FDA commissioner says doctors will still recommend pregnant women use Tylenol if needed.
And there's been some small studies suggesting that there could be a correlation. Again, worthy of further study, but there is no clear evidence that it causes autism for women who take it during pregnancy.
Following on encouraging early trials, the administration is also suggesting the drug leucovorin to treat children with autism.
And that was Fox's Rich Edson bringing us the story. We do have standing by here Dr. Evan Nadler. He's a pediatric surgeon and researcher. Let's just start with the basics here. What's the basis of this decision, doctor? What does the science say about, and I got to ask you also, we're talking about Tylenol, but we're talking really about the active ingredient in Tylenol, as Rich was alluding to, acetaminophen. What does the research say about the drug, and what does it say about its relationship with pregnancy?
Yeah, thanks, Austin, for having me. And this is an important discussion, obviously, because there's still some confusion out there about what this really means. And you correctly point out that it's acetaminophen, which is the generic name of Tylenol. And if you go to CVS and you buy acetaminophen, that doesn't necessarily have any different effect than if you buy the brand name of Tylenol. So it is important to use the generic name, acetaminophen. So what the data show is that in one study, there was what we call an association between acetaminophen use during pregnancy and an end result of people with autism or autism spectrum disorder. But there are other studies that don't show that association, which is why a lot of the scientific community isn't particularly sold on this recommendation that women during pregnancy avoid acetaminophen. And I think what's really important for people to understand in science is that an association doesn't mean a causation. So it might be that pain causes autism and people take acetaminophen because they have pain, but the acetaminophen has nothing to do with the cause of autism. Or like others have said, the fever. A low-grade fever might be something that triggers some genetic susceptibility that then leads to a patient with autism spectrum disorder. But the acetaminophen that someone might take for that low-grade fever has nothing to do with it. So there is a suggestion, at least in one study, that there's an association, but there's far from any data that shows a causation.
So I'm going to put up a statement here from the president of the American College of Obstetricians and Gynecologists. They said earlier today that suggestions that Tylenol use in pregnancy causes autism are, quote, irresponsible when considering the harmful and confusing message they send to pregnant patients, unquote. Also saying today's announcement by Health and Human Services is not backed by the full body of scientific evidence and dangerously simplifies the many and complex causes of neurologic challenges in children. Final paragraph saying it is highly unsettling that our federal health agencies are willing to make an announcement that will affect the health and well-being of millions of people without the backing of reliable data. I've read that the reality is that autism is multifactorial in origin. How do we know that it is multifactorial in origin?
So that's actually a great question. And multifactorial can sometimes be a vague term. So what the science suggests, the strongest science suggests that there is a genetic component to the development of autism spectrum disorder. What we don't know is how that genetic susceptibility manifests itself. So there probably is some other trigger of some sort, which likely happens during pregnancy. And it certainly could be a fever or some other environmental exposure that we don't know about. And then the thing that makes it actually the most difficult is that it usually has to have the patient with the person with a genetic susceptibility has to have the right environmental exposure, but then it also has to happen at the right time. There's only a certain period, like the brain develops in the first trimester of pregnancy. So that might be where that environmental trigger has to happen. So anytime you have a disease that has a bunch of different ways of expressing itself, so like some people have severe autism, some people have mild autism. Those types of diseases generally have multiple different causes that show up in multiple different ways once people develop symptoms.
So why is acetaminophen the only pain medicine that's usually used during pregnancy, and what would eliminating its use mean for pregnant women?
Right. So I think, well, first of all, the sort of other generic medicine that people know about is ibuprofen, which is Advil or Motrin. And the science behind that medicine being more harmful to the developing baby is much stronger. Kidney problems, among others, for babies whose parents take what's called a nonsteroidal anti-inflammatory medicine, or an NSAID, during the final, after 20 weeks gestation. So those data are stronger, and we don't know what exactly the risk is if you take ibuprofen before 20 weeks, but we think there's probably risk there too. So that's why acetaminophen has been the one that's been most commonly recommended. And, you know, I think what's likely to happen isn't that people are going to stop using it based on the announcement today. I think there will be people who go to their physician and ask about it before they might have normally just taken it at home, but now they're going to ask their OB before they do that, maybe. And most likely the OB is going to say, go ahead and take it. So I'm not sure there's going to be a huge, a huge number of pregnant women who are going to just suck it up and suffer through the pain. I don't think that's likely. So I think, there might just be maybe a smaller percentage of usage, but I think more likely it's just going to be that folks have to talk to their obstetrician, and then they'll make a decision between the patient and the provider that will likely end up in a recommendation for Tylenol, unless there's, unless the person who's the pregnant woman doesn't want it.
Dr. Evan Nadler is a pediatric surgeon and researcher. Thanks for coming on.
My pleasure, anytime.
All right. So what we're going to do is we'll show you this real quick. This is a statement from Tylenol's maker, Kenvue, responding to what the White House said today. They say, "We believe independent, sound science clearly shows that taking acetaminophen does not cause autism. We strongly disagree with any suggestion otherwise and are deeply concerned with the health risks that this poses for expecting mothers."